My name is Hava Phillips, and I am the supervisor of the Communicable Disease Unit for Public Health. Contact tracing is the method by which we find out how many people may have been exposed to a given case of a disease. If one person affects 2 people, each of those 2 people will then go on to affect 2 people. So now you've got 4, and each of those 4 people will go on to affect 2 people. And the way that looks, if you graph it out, is that it's pretty slow at first, and then as that number becomes, there are 50 people who can each infect 2 people, you can end up with a lot of cases all at once. And so the goal for us is to prevent spread. And so if we can contact that first person and say, who have you been around? And they give us the names of all of their contacts, we're hoping that we will catch both of those people that they could potentially have infected, have them quarantined so that they don't go anywhere. And that way, if they do become symptomatic, they don't infect anybody else, and we cut that off right there. In that situation, we call them, we let them know they're on quarantine, and we will send them official quarantine orders so that they have that documentation that they are quarantined. Sometimes they need it for work, but it also protects us so that we can say, yes, we did in fact tell you that you were supposed to be on quarantine. Right now we're calling them every day. I think that a truly dedicated person can find a way around any system, but most people are really actually pretty invested in making sure that nobody else does get sick, and they really want to do everything in their power to keep that from happening. Legally, we do have the ability to post people outside of a home and make sure that nobody leaves. In my experience, we have not ever had to do that. We know it's a possibility, we're prepared to do that, we have all the paperwork in place to make it happen if we need to, but it just is not something that we've needed to do at this point. If we're working with somebody who in the course of their daily life doesn't have access to adequate food, then we will partner with an organization who can deliver food or provide supplies that we potentially have, like thermometers. So yeah, it just very much depends on, and it's matched to what the person needs in their everyday life. Contact tracing is important because that's what allows us to stop the spread of a disease. It's assumed that it will spread, but the goal of contact tracing in this situation is to make that process as slow as possible so that we don't ever hit the point where we're doing this, because our hospital capacity is probably right there. So what we're hoping is that we can slow that down. Contact tracing is what we do kind of every day for all of our diseases, everything from syphilis to E. coli. It's the same process, but it doesn't usually happen on this large of a scale.